Hello, we're Royal Wellis Academy. Is your diabetes recovering, or is it getting worse? If you're recovering, it's great. Just do it as you are now. But honestly, is diabetes recovering or getting worse? I'm just trying to guess when I'm taking my blood sugar, but I don't really know. But the truth is, the body keeps sending signals that diabetes is getting worse. These signals are similar to the symptoms that are common in everyday life. I don't even know it's a sign of diabetes getting worse. The first thing I'm going to tell you is edema. But even though I ate delicious food and slept late at night, I said I wasn't swollen. Some of you might think of swelling lightly. That's right. You don't have to worry too much about swelling after eating delicious food. But the swelling that I'm going to tell you today is not the swelling that occurs after eating delicious food late at night. Edema occurs when the kidneys are damaged due to diabetes. I will tell you today about the swelling caused by falling asleep after eating delicious food late at night and the lack of it. The first sign of diabetes getting worse is edema. The way to distinguish normal swelling from diabetes exacerbation is to press the area where the swelling occurs with your hand. What if there is a dent when pressed and then slowly comes up? Your diabetes is severe, and you're more likely to have edema. This swelling is a symptom of diabetic kidney disease. A typical diabetes complication. Diabetic kidney disease occurs when the blood-filtering glomeruli in the kidneys are exposed to high blood sugar for a long time. Inflammatory substances produced by long-lasting hyperglycemia damage surrounding tissues or impair their function. What if high blood sugar damages the kidneys that act as filters in our body? It also excrete important substances such as protein that you don't want to let out into your urine. This is called proteinuria. When proteinuria occurs, the moisture in the blood vessels escapes out of the blood vessels due to osmotic pressure. Swelling occurs. If you have severe proteinuria like this, it'll be discharged by mixing a lot of urine foam. If the foam doesn't disappear even after a minute after urinating, you can see it as white milk, so please refer to this. Now, what is proteinuria? You can tell, right? If there's swelling in urine that doesn't bubble up like this, there's a high possibility of kidney disease. In addition to swelling and foamy proteinuria, when your kidneys fail, you may experience symptoms of lethargy, unprovoked fatigue, loss of appetite, and itching of the skin. If you eat delicious food late at night and get swelling, your skin doesn't get itchy. But besides edema, we still have 3 more signals. I can't be relieved that there's no swelling. You have to check the rest of the signals to see if diabetes gets worse. I can check for sure. The second additional sign of diabetes getting worse is decreased vision. Is it normal swelling for people with swelling? Is it because of diabetes? As you were confused, it's a clever sign that you can think of as a simple presbyopia. Being old and stiff and tired may be a symptom of simple aging. You can suspect that vision problems, such as blurred vision, are symptoms of diabetes. Diabetic retinopathy causes the deterioration of the retina's function in charge of vision due to such severe diabetes. Diabetic retinopathy is the leading cause of blindness worldwide. What if diabetes gets worse? High blood sugar damages the blood vessels in your eyes. What if that happens? Like water is being pumped out of a damaged water pipe. The substances in the blood count out of the damaged blood vessels little by little. When these substances are counted into the retina, the capillaries in the retina can become clogged, causing edema or bleeding. This causes some loss of vision, blurring, night blindness that is hard to see at night. You may experience symptoms that are sensitive to strong light. There are a lot of people looking for lutein because they take eye supplements. In this case, lutein is good, but it's better to take vitamin C with lutein. It helps to keep your eyes healthy. The third sign of diabetes getting worse is sensory dysfunction. Long-lasting high blood sugar conditions can damage the nerves and cause various problems. These problems often occur in peripheral nerves such as hands and feet. I've been bothering my feet the most because your feet are the furthest part of your body. Diabetic neuropathy is when neurological abnormalities occur due to this severe diabetes. Have you heard that there are people who amputate their toes due to severe diabetes? Diabetic neuropathy is a terrifying complication that causes quadriplegia due to diabetes. What if high blood sugar damages nerve fibers? Tickle, pain, burning, throbbing, feeling like something is attached to it, like walking on sand or beads, can cause various sensory abnormalities. On the other hand, numbness is a kind of sensory abnormality. In particular, what if these symptoms appear on the foot, and the foot breaks or wounds occur for no reason? It may be an early symptom of a diabetic foot disease called diabetic foot. However, there is still one more unexpected signal left, to the point where I think that if diabetes worsens, even this gets worse. Even those who did not fall under the previously known signal are more likely to fall under the last symptom. Since you've seen it so far, make sure to check it out until the end. The fourth sign of worsening diabetes is periodontal diseases such as tooth decay, bleeding and periodontal inflammation. Now, the cavity in the mouth is also due to diabetes. What if your cavity got worse after you had diabetes? It's because of diabetes. Periodontal disease is so closely related to diabetes that it is the sixth complication of diabetes. In the American Diabetes Association, diabetics have weaker immunity than healthy people, so periodontal disease progresses faster and more severely. If you eat candy, your teeth will rot. Diabetes is like biting candy all day. Therefore, the incidence of periodontal disease in diabetic is 3 times higher than in normal people. On the other hand, bacteria that cause periodontal diseases interfere with insulin's function, making diabetes worse. In other words, what if the diabetic is not treated for periodontal disease? Diabetes and periodontal disease make each other worse. What if you get periodontal disease due to this severe diabetes? The teeth of the swollen and bleeding gums may shake and the gums may sit down, revealing the roots of the teeth. What if you developed this periodontal disease after being diagnosed with diabetes, or your existing periodontal disease is weakening faster? It could be a sign that diabetes is getting worse. I'll wrap it up for the last time. What are the 4 signs of diabetes getting worse? Do you remember? Swelling that recessed when pressed, blurred vision loss, sensory abnormalities that lead to abnormal senses, mainly in the hands and feet, periodontal diseases including tooth decay, bleeding, periodontal inflammation. Please remember this, especially if edema is diabetic. A typical symptom of a disease is, if it is accompanied by proteinuria mixed with foam, I strongly recommend you go to the hospital and get tested first. How many of the symptoms I told you about today do you have as well? Just as it is much easier to catch it in the pre-diabetes stage, if worsening diabetes detects these signals quickly, you can treat it before you lose more of your body's function. What if there are people around you who are fighting diabetes? Please give me such good information. See you next time when you're healthier. If you enjoyed watching the video, please subscribe and like.